Hi, my name is Dr. Ariana Chao. I'm an assistant professor at the University of Pennsylvania School of Nursing and medical director at the Center for Weight and Eating Disorders at the Perelman School of Medicine. Today, we'll be talking about obesity, stress, and the COVID-19 pandemic. It's hard to believe we're already 2 years into the pandemic. For many, the constant uncertainty, disruptions from our routines, and isolation from loved ones and families have come at a cost. Depression, anxiety, and levels of stress have increased dramatically. Paralleling these increases in mental health concerns, we've also seen increases in behaviors associated with obesity. For example, we've seen decreased amounts of physical activity since gyms were closed, and less walking because people were working from home. We've seen increased reports in people relying on comfort foods and alcohol and high-calorie foods in order to cope with stress related to the pandemic. As an obesity researcher, I'm especially concerned with the relationship between stress and eating during the pandemic. We know that in the short term, stress actually shuts down our appetite and decreases it. That's because our nervous system sends out hormones such as epinephrine, also known as adrenaline, which triggers our body's fight or flight response and temporarily decreases eating. However, if stress persists, as we've seen during the pandemic, it's a different story. Our body starts to secrete more cortisol, which increases appetite, our motivation to eat, and our preferences for foods high in sugar and fat. So, what can we do? Throughout the pandemic, I've been helping my patients to both manage their stress and manage their weight. One of the tips that I frequently give them is to create a simplified routine as much as possible, to work on meal prepping during the weekends and planning out what they're going to eat during the week, to keep a running grocery list on their phone so that way they can pull it out when they have time to go grocery shopping, and repurposing leftovers so that way they have something for lunch the next day or for dinner the next day. Another tip is to engage in stress reduction activities. Things like going for a walk during the day, meditation, yoga, listening to music, or maybe trying a new hobby. It's also important to connect with family or friends. Giving people a call and going through what they're stressed out about throughout the day can really be helpful. And lastly, to ask for help, to reach out to your primary care provider, a mental health specialist, or a weight management specialist. Thanks so much for listening.